Dr. Paul here. We just finished our 4-year checkup and you had news.
Yes, I'm pregnant.
Yay, that's exciting. So you're 3 months from having a new baby. That's so exciting. Has your OBGYN invited you to have vaccines?
They have, but I declined.
Okay.
Because I had it with him. And then again, I learned everything about vaccines and just staying away from everything. So.
Gotcha. So for our viewers, if you're pregnant, the current recommendation out of the CDC is a flu shot every pregnancy. And for the last 3 or 4 years, they've been recommending the Tdap, the diphtheria, tetanus, pertussis. The main concern there was whooping cough because most of the deaths are in infants, 3 months and under. Well, how many deaths are there? You don't want to lose your baby to pertussis, correct? Correct. Well, there's about 5 deaths per year out of 4 million births. So there is a risk, but you need to understand what it is. It's about 1 in a million. Now, most of those deaths happen under 3 months of age. So, typically parents are getting the first Tdap, the pertussis vaccine, at age 2 months. And so their thinking theoretically was, well, let's give mom this vaccine. She develops antibodies, passes them to the baby, so they're born with some protection. And I'm sure that happens to a small extent. But most of the pertussis in this country now is pertactin protein negative, and the vaccine it activates an antibody that looks for pertactin. So it's no longer targeting the right organism. So the vaccine isn't working as well as it should. But more important than anything is you're injecting aluminum into a body that's hosting a brand new developing brain, and aluminum is a neurotoxin. So I would encourage viewers, go to vaccinepapers.org and look up the information about aluminum toxicity and immune activation. Because when you overactivate the immune system, we know that getting the flu while you're pregnant is not good. There have been some developmental delays caused by getting the flu while you're pregnant, basically getting almost any illness while you're pregnant, so stay away from sick people. Right. But when you give a vaccine while you're pregnant, you're activating the immune system guaranteed, so you're going to cause guaranteed risk of developmental issues. And studies have shown this. So some thinking parents are choosing not to vaccinate during pregnancy. If you have a family history of autoimmune issues, which is a whole long list of autoimmunity, from celiac to inflammatory bowel disease to MS to diabetes type 1, etc., etc. Or if you have any family history of autism, autism spectrum, any kind of delays, your first child, we could say had some of those concerns, you clearly want to be careful, extra careful about injecting vaccines while you're pregnant and overactivating the immune system. So good job on saying no to that. So the other big point I make for pregnancy and when you're just trying to protect that baby is what balances the immune system, because a balanced immune system is what keeps us healthy. Real food, organic if possible. Stay away from gluten probably because it's inflammatory for most people. Take extra vitamin D. The prenatal probably has 1,000. You need about 4,000 to 5,000 IUs a day of vitamin D. Minimize stress. So, I'm driving to work and I'm listening to the news and I'm hearing some stressful things and I feel my stress go up. I switch it to music and what? That's better. So turn off the news. Who needs it, right? It's negative. And if you're pregnant and you're working, just minimize the stress that you can, right? Because you can be in the middle of chaos, and as long as you have a philosophy where you realize, I can't do anything about those people, right? All I can control is me and my response. You can keep your stress level low, which is really good for developing brain. And then finally, we want to get enough sleep. That gets harder and harder as you get further along, but take your naps, do whatever you can to do that. Biome is healthy bacteria in our gut. That's also important for balancing the immune system. So eating fermented foods, taking probiotics, those are things that can help. And surround yourself with wonderful people, supportive, nurturing people. And if there's toxic people, let's stay away from them. Okay. Right? Because you're going to be Mother Earth. So those are my pregnancy tips. And beyond that, I would say, I can't remember if the first baby was vaginal or C-section.
Vaginal. Okay,
so you'll probably be fine then having a natural birth, as natural as possible.
Right.
I would avoid nitrous because when you have some neurological stuff running in the family, there seems to be a link between nitrous and some problems. Oh. There's a few hospitals that are starting to use nitrous. Yeah. If you can go natural, great. If you absolutely have to do something, then probably an epidural would be your next best bet.
Yeah, with him, I was trying to do as drug-free as possible.
Yeah.
And my body wasn't kicking, and my water broke, and then my body never kicked into gear, like active
Gotcha.
labor. So then they just
They induced you.
No, they put me on Pitocin without an
Right.
epidural
Yeah.
because I was trying to do
Yikes.
as little as possible.
Yeah.
And then he was sunny side up,
Oh, dear.
super painful.
Yeah.
Then I got the epidural, and finally,
We're able
after
to do it.
45 hours, he finally.
That's
So I like my body wouldn't go into,
Yeah,
and
that
my
happened
water
with-
had already broke.
yeah.
so
That happened with us too.
Yeah.
We had a similar experience.
It's awful.
Yeah. So anyway, there are a lot of things you can do for pregnancy to keep this baby as safe and protected as possible. You're on it. So I just wanted to just remind you about those things. And then when you check in to have your baby in the hospital, you're signing for routine care. In most hospitals in America, that includes a hepatitis B vaccine, a vitamin K shot, and eye ointment. Just to cover those real quick, you catch hepatitis B from sex and IV drug use. Your baby's not going to do that. There is zero risk of your baby getting hepatitis B unless you have hepatitis B, and we know you don't. So you can absolutely, and you should, say no, just say no, to the hepatitis B vaccine. You can do it when they're teenagers, before they're sexually active. The vitamin K, they all do contain some toxins, so you may choose to do oral drops, but as long as it doesn't have aluminum, you get a vitamin K brand that doesn't have aluminum, it's okay. And then the eye ointment, it's left over from the 1800s when they used to do silver nitrate to prevent blindness from syphilis and gonorrhea. In the 1980s, we switched it to erythromycin ointment. It's relatively harmless, but it's also probably fine to skip it and put breast milk in the eye. Those are some controversial, weird, natural, blah, 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 blah. I'm Dr. Paul, giving you the best I can of prenatal care. Congratulations. I'm so excited for you guys.
Dr. Paul.
Thank you for letting us share the audience on what to think about if you're pregnant. I'm Dr. Paul.
# always consult your physician.